Question number 1. What is the first step in any first aid procedure? The right option is option C. Assess the scene for danger. Question number 2. The recovery position is used for a victim who is. The right option is option D. Unconscious but breathing. Question number 3. How long should you check for breathing before starting CPR? The right option is option A. 10 seconds. Question number 4. The Heimlich maneuver is used for. The right option is option D. Choking. Question number 5. Which method is best for controlling severe bleeding? The right option is option A. Direct pressure. Question number 6. What is the correct method to open the airway of an unconscious victim? The right option is option D. Head tilt, chin left. Question number 7. When treating a fracture, the first aid goal is to. The right option is option C. Immobilize the affected part. Question number 8. For a nosebleed, the correct first aid technique is to. The right option is option C. Tilt the head forward and pinch the nose. Question number 9. What is the first aid for a conscious person with symptoms of shock? The right option is option B. Lay them flat and raise their legs. Question number 10. In case of chemical splashes to the eyes, the first step is to. The right option is option D. Rinse with clean water for at least 15 minutes. Question number 11. What is the appropriate action for a suspected spinal injury? The right option is option B. Immobilize the neck and avoid movement. Question number 12. When performing CPR on an infant, how many fingers are used for chest compressions? The right option is option A. 2. Question number 13. Which of the following is not a principle of first aid? The right option is option D. Perform surgery. Question number 14. What is the immediate action for a person having a seizure? The right option is option C. Protect from injury and let seizure end. Question number 15. What is the correct depth for chest compressions during adult CPR? The right option is option D. 5 to 6 centimeters. Question number 16. In case of an impaled object, e.g. knife, what is the correct first aid procedure? The right option is option C, stabilize the object and control bleeding. Question number 17. The most effective method to check consciousness in an unresponsive adult is to. The right option is option A, shake the person and shout. Question number 18. Which of the following is an early sign of hypovolemic shock? The right option is option C, rapid pulse and low BP. Question number 19. What is the recommended method for opening the airway of an unconscious patient with suspected spinal injury? The right option is option B, jaw thrust maneuver. Question number 20. When bandaging a wound, the first priority is to. The right option is option C, control bleeding. Question number 21. Which of the following is the correct hand position for chest compressions during adult CPR? The right option is option B, both hands over lower half of the sternum. Question number 22. What is the best first aid measure for a suspected heart attack? The right option is option C, help them lie down and keep calm, give aspirin. Question number 23. Which of the following positions is appropriate for a person with breathing difficulty? The right option is option A, sitting or semi-fowler position. Question number 24. After a bee sting, what should be done immediately? The right option is option C, remove the stinger with a scraping motion. Question number 25. What is the correct action for a chemical burn on the skin? The right option is option B, rinse with water for at least 20 minutes. Question number 25. For CPR in a child 1 to 8 years, the correct compressions technique is. The right option is option D, one hand compressions on the chest. Question number 27. The rule of nines is used in first aid to assess. The right option is option D, percentage of body surface burned. Question number 28. In the case of poisoning, what is the most important first aid principle? The right option is option C, identify the poison and seek medical help. Question number 29. When splinting a fracture, you should immobilize. The right option is option A, both the joint above and below. Question number 30. The first aid treatment for minor cuts includes all except. The right option is option D, leave it open to air always. Question number 31. In an unconscious diabetic patient, What is the priority first aid? The right option is option A. Provide glucose if possible. Question number 32. During CPR, the recommended depth of chest compression in adult is. The right option is option B. 2 to 2.4 inches. Question number 33. The first step in managing a person who is choking is to. The right option is option D. Encourage them to cough. Question number 34. What is the appropriate first aid for a chemical burn to the eyes? The right option is option C. Flush the eyes with water for at least 15 minutes. Question number 35. When dealing with a suspected spinal injury, you should. The right option is option B. Support the head and neck and avoid movement. Question number 36. Which of the following is not a sign of internal bleeding? The right option is option C. Visible external wounds. Question number 37. In first aid, the rule of 9 is used for. The right option is option A. Assessing burn surface area. Question number 38. For a conscious person with hypoglycemia, the best first aid is. The right option is option C. Give sugary food or drink. Question number 39. How often should rescue breaths be given during CPR for a child? The right option is option D. After every 30 compressions. Question number 40. Which of the following is the primary goal of first aid? The right option is option C. Preserve life and prevent the condition from worsening. Question number 41. The Heimlich maneuver is used in case of. The right option is option D. Choking. Question number 42. In first aid, what is the best action to take when someone has a suspected fracture? The right option is option C. Immobilize the area and seek medical help. Question number 43. The best first aid for an embedded object in a wound is to. The right option is option A. Leave it and bandage around it. Question number 44. Which of the following is a sign of heat stroke? The right option is option B. High body temperature and no sweating. Question number 45. What should be done first for a bleeding wound? The right option is option D. Apply pressure around the object and stabilize it. Question number 46. What is the best way to manage a nosebleed? The right option is option D. Pinch the nose and lean forward. Question number 47. What is the correct position for a person in shock? The right option is option B. Lying flat with legs elevated. Question number 48. A triangular bandage is commonly used for. The right option is option A. Sling for arm injuries. Question number 49. What is the immediate action for an unconscious victim not breathing? The right option is option D. Start CPR. Question number 50. When applying a sling, the injured arm should be placed at what angle? The right option is option B. 90 degree.